Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Pravastatin. Its brand name is Pravachol. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Pravastatin is a competitive HMG-CoA reductase inhibitor. It decreases intracellular cholesterol levels through reversible inhibition of HMG-CoA reductase activity. In terms of indications for use, Pravastatin is indicated to be used in the treatment of hyperlipidemia. It can be used to treat familial hypercholesterolemia. Pravastatin can be used to reduce the risk of a cerebrovascular accident. And it can also be used in the setting of coronary atherosclerosis. Now, before somebody was to use Pravastatin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with a hypersensitivity to Pravastatin or any other component of the product would not be able to use this medication. If a patient had unexplained persistent elevations of their serum transaminases, they would also not be able to use Pravastatin. Medication cannot be used during pregnancy or in nursing mothers. And finally, patients with active liver disease can also not use Pravastatin. Now, in terms of precautions, patients should be made aware that heavy alcohol use may increase the likelihood of liver function abnormalities. In patients who have ALS, they should be told that while using Pravastatin, the rate of functional decline of their ALS may increase. Conditions that predispose patients to renal failure secondary to rhabdomyolysis, such as sepsis, hypotension, trauma, major surgery, uncontrolled epilepsy, or electrolyte disorders, should temporarily withhold or discontinue the medication. Elderly patients greater than the age of 65 may be at an increased risk of experiencing myopathy or rhabdomyolysis while using Pravastatin. Patients with a recent history of liver disease, so in the past 6 months, would be at an increased risk of experiencing liver function abnormalities. Liver failure, with some fatal cases, have been reported. Patients with a history of renal or kidney impairment would also be at an increased risk of myopathies or rhabdomyolysis. And finally, increases in serum transaminase levels above 3 times the upper limit of normal has been reported and sometimes lead to medication discontinuation. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Pravastatin, they can expect to receive their dose orally. When treating hyperlipidemia, for example, initially they would start off with 40 milligrams once daily. For maintenance therapy, a patient may use 40 to 80 milligrams once daily. For coronary atherosclerosis, the dosing would be the same, 40 milligrams once daily initially, followed by 40 to 80 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Pravastatin, so we'll go over some of those here now. 1 to 7% of patients may experience a rash. 4.5 to 8.5% of patients may experience diarrhea. Nausea and vomiting may happen between 4 and 10% of the time. And 4 to 25% of patients may experience musculoskeletal pain. 3 to 7% may experience a headache. And a cough can happen between 1 and 8% of the time. Rhinitis may happen up to 7% of the time, and an upper respiratory tract infection may happen up to 21% of the time. Now, some more rare but serious side effects will be pancreatitis, increase in liver enzymes, rhabdomyolysis, rupture of a tendon, and finally other disorders of muscle. That's all we're going to talk about today with Pravastatin, or Pravachol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.